How does Cuban healthcare compare to other countries? Cuba's healthcare system is a fascinating topic that often surprises many. It operates under a fully government-run model, providing free healthcare to all residents. This approach is rooted in the belief that medical care is a right, a principle embedded in Cuba's constitution since 1972. One of the standout features of Cuban healthcare is its focus on preventative care and community-based services. Since the 1970s, Cuba has implemented the polyclinic model. This means primary care specialists, like pediatricians and obstetricians, work directly within neighborhoods. This local access allows doctors to build strong relationships with their patients. They can consider various factors, such as social and environmental influences, when treating individuals. In many capitalist countries, healthcare can often feel fragmented and less community-oriented. In contrast, Cuba requires all medical students to complete family practice residencies. This reinforces the system's commitment to family and community health. With about 7.6 doctors per 1,000 people, Cuba has one of the highest densities of physicians in the world. This ensures that all citizens have accessible care. Despite facing economic challenges, including the United States embargo and the loss of Soviet subsidies, Cuba maintains impressive health outcomes. For example, its infant mortality rates are low, and life expectancy is high, often comparable to or even better than many wealthier nations. These achievements highlight the socialist commitment to viewing health as a public good rather than a market commodity. Cuba has also developed a biotechnology industry that plays a significant role in its healthcare system. The country has sent thousands of health professionals abroad to assist poorer nations, often at little or no cost. This reflects the socialist principle of solidarity and international cooperation, extending Cuba's healthcare impact beyond its borders. However, there are challenges. Cuba faces shortages of medications and medical equipment, and healthcare workers often receive low salaries. There can also be disparities in service quality between locals and foreigners. These issues stem from economic constraints but do not overshadow the system's strengths in universal care and prevention. From a socialist viewpoint, Cuban healthcare showcases how a planned economy and collective responsibility can create a health system focused on equity and community well-being. This stands in stark contrast to capitalist models that often prioritize profit over universal access. The Cuban experience illustrates that even with limited resources, a socialist healthcare system can achieve health outcomes that rival those of wealthier nations by prioritizing social determinants of health and integrating healthcare into community life.